Presbyopia is a common vision condition that affects people as they age. It leads to difficulties in focusing on near objects, making tasks like reading and using digital devices challenging. This video will explore the anatomy, physiology, diagnosis, treatment, and complications of presbyopia for a better understanding of this refractive error. Presbyopia involves multiple structures of the eye, including the lens, ciliary muscle, zonules, and suspensory ligaments. The lens, a transparent elastic structure, undergoes changes with age that affect its ability to accommodate for near vision. The ciliary muscle, responsible for altering the shape of the lens, weakens and becomes less flexible as individuals age. Additionally, the zonules and suspensory ligaments supporting the lens lose their elasticity over time, further complicating the accommodative process. Understanding these anatomical and physiological changes in relation to presbyopia provides a foundation for comprehending the subsequent topics. Accommodation refers to the eye's ability to adjust its focus to view objects at various distances. In presbyopia, several mechanisms and processes are involved, including the contraction and relaxation of the ciliary muscle, the shape changes of the lens, and the redistribution of fluids within the eye. With age, these mechanisms become less efficient, leading to a reduced ability to focus on near objects. Understanding the intricacies of these mechanisms aids in developing effective treatment strategies for presbyopia. Presbyopia is classified as a refractive error, similar to myopia, hyperopia, and astigmatism. However, presbyopia differs from other refractive errors as it is primarily age-related and progressive. It is essential to understand the relationship between presbyopia and other refractive errors, as individuals may have multiple refractive errors simultaneously. This knowledge helps clinicians tailor treatment approaches to address both presbyopia and the coexisting refractive errors effectively. Presbyopia develops gradually as individuals age and typically becomes noticeable around the age of 40. Understanding the chronological progression of presbyopia and the associated changes in visual acuity is vital for recognizing and diagnosing this condition. Clinicians should be familiar with the typical timeline of presbyopia and the expected decline in near vision to provide appropriate interventions at the right time. Presbyopia affects individuals worldwide, regardless of gender, race, or ethnicity. However, certain risk factors can predispose individuals to develop presbyopia earlier or experience more significant visual disturbances. Exploring the epidemiology of presbyopia, including prevalence rates and associated risk factors such as genetic factors, ocular and systemic diseases, and environmental influences, assists in identifying high-risk populations and tailoring preventive measures. Recognizing the clinical presentation and symptoms of presbyopia is crucial for early diagnosis and intervention. Symptoms typically include difficulty focusing on near objects, eye strain, headaches, and the need to hold reading material at arm's length. Comprehensive knowledge of these symptoms and their impact on patients' quality of life enables practitioners to provide appropriate management strategies. Various diagnostic tools and techniques aid in identifying and assessing presbyopia. These include comprehensive ocular examinations, assessment of visual acuity, and specialized tests to evaluate the refractive errors and amplitude of accommodation. Understanding the indications, limitations, and interpretation of these diagnostic tools assists in accurate diagnosis and treatment planning. Several treatment options are available for managing presbyopia. Corrective lenses, including reading glasses, bifocals, trifocals, and progressive lenses, are commonly recommended to improve near vision. Additionally, surgical interventions such as monovision LASIK, conductive keratoplasty, corneal inlays, and lens-based surgeries provide alternative approaches. An in-depth understanding of these treatment modalities aids clinicians in selecting the most appropriate option based on patients' visual needs and expectations. Apart from corrective lenses and surgical interventions, various accommodative therapies exist for managing presbyopia. These include pharmacological agents, such as miotics and prostaglandin analogs, and visual training exercises. Familiarity with the efficacy, safety, and appropriate indications for these therapies assists clinicians in individualizing treatment plans for presbyopic patients. Presbyopia, if left untreated or managed inadequately, can lead to several complications and associated conditions. These include asthenopia, binocular vision abnormalities, musculoskeletal discomfort, and decreased productivity. Recognizing these complications and understanding their impact enables clinicians to address them promptly and comprehensively in presbyopia management. Patient counseling and education play a vital role in ensuring successful presbyopia management. Educating patients about the natural progression of presbyopia, available treatment options, and anticipated outcomes helps set realistic expectations and fosters patient compliance. Effective communication strategies, including providing information in a patient-friendly manner, addressing concerns, and involving patients in shared decision-making, contribute significantly to the overall management process. The field of presbyopia management undergoes continuous advancements and innovations. Ongoing research focuses on novel treatment modalities, such as accommodative intraocular lenses and pharmacological interventions to enhance accommodation. Staying updated with the current research trends and future directions enables clinicians to provide the best possible care to presbyopic individuals and explore emerging treatment options. Presbyopia is a complex condition requiring extensive knowledge of its anatomy, physiology, diagnosis, treatment, complications, and counseling. With this knowledge, healthcare professionals can confidently manage presbyopia and enhance the lives of those affected.